Welcome to Sonic Family Chiropractic and Life Wellness, and today we're going to go over the Webster Technique. It was explained in a previous video, but now we're going to do the actual technique on an actual pregnant woman. Fee is our model, and you can tell that she is nice and pregnant. No, this is not a basketball, it's right here. So we'll have her go ahead and get on the table. And because she's a little bit bigger, right here in the midsection, we add the pillow for extra room for her belly to fit in. So as we explained in the other video, what we're going to do is actually the Webster Technique. The part of the technique, first we look at the sacrum and the sacroiliac joints down here. How we test for that is we take, just relax there for me, take one leg at a time and go back. Which one goes back farther to the buttocks? And here we see the right go back farther than the left leg. So what I'm going to do, I'm going to do an adjustment right here to the left SI joint. The piece is going to raise up, and the piece just lowers. We do this a couple times, and then I'm going to recheck. And as we bring the legs back, we notice they both go back about the same distance. The other part of the Webster Technique is putting pressure on the round ligament. So push up to your knees for me, all the way up. We're going to have her flip over on her back. Next, we're going to find the round ligament. And how we're going to do that is we find right where her belly button is. And there's a little bone that sticks out, known as the ASIS, right in here, part of the pelvis. We're going to find pressure right along here. So what I'm feeling is for a little knot right along the round ligament, and all I do is hold slight pressure. I also find where the baby's head is, and in a breech presentation, the head's either going to be over to the side or up, and a lot of times the women will feel kicking down here in the lower abdomen. So all I'm doing is holding pressure, putting my hand gently on the head, and when I notice that part, that little knot go away on the round ligament, then I know that's when the adjustment is done. So all it takes is about holding it for about 30 seconds to a minute. And I have the woman just relax and actually visualize that the baby's being head down. And once I do that, a lot of times I will feel the baby actually move within utero, a lot of movement through here. Not necessarily flip all the way upside down, but I get a lot of movement when I do this technique. So that is the Webster Technique. Usually the baby will flip within 1 to 8 visits. If a baby does not flip after 8 visits, there could be either a cord wrapped around the head or something else that's not allowing the baby to flip. Watch the other video on the Webster Technique, and that'll also explain more of what we do.